Hello everyone, this is Genevieve Nottage from Chronicles Billing, and I just want to give you the top 10 things that I feel you need to know to be well prepared for the lab and pathology section on the exam. I also have a little video here. I just want to share just a few snippets with you of its importance, and then I'll send the PowerPoint to you so you can watch the full presentation if you choose. It's only about 6 minutes long. While this is loading, please make sure that you have your CPT. Right now, I'm on page 471. As you can see here, there's some test tubes. That's a Petri dish. This is cryopreservation. And this is the provider at Pennsylvania University of Pennsylvania. And here you can see some of the phlebotomists doing some of the tests. Now, many specimens are received by the labs every day, over 5,000. So when the doctor is sending your information out for lab work, this would be a modifier. Well, modifier 91 is if you're going to be doing more tests on one particular specimen. Yeah, so here you can see the phlebotomist withdrawing the blood. And then they're going to process the sample, package them, and then ship them off to the main lab. This is an automated processing laboratory, as you can see. So you can see they've been barcoded, and then they're placed on the automated track. So they're being set up for testing here. And so, of course, there's different types of testing. We'll talk about a few of those and the things that you need to focus on for them. Yeah. So that's the little life of the sample in the automated lab. All right, so I'm going to go ahead and just stop that. Again, I will have it in the PowerPoint presentation so that you can watch the full length of it. It's only 6 minutes and 56 seconds, as you can see here. Let's dive right on in. We're going to talk about panel coding. Okay, if you're looking on your reference page, if you're on page 471, then you should be turning to page 488. That's where we're going to talk about the panel codes. Remember that with panel codes, this is just a review, with panel codes, it's all or nothing. So if you're looking right now at CPT 80047, you can see all of the tests that are included in that CPT. Now, for example, I'm going to talk about a patient. This is a scenario. They're coming in for a CMP, which is a comprehensive metabolic panel, and they're also going to have a renal function panel. Now, if you look at the two CPT codes, you can kind of check off, all of the tests that are involved in a CMP, and you will notice that CPT code 84100 is not included in that CMP. So if a patient came in to have a CMP and a renal function panel, your answer would be 80053 and also 84100. As you can see, that phosphate, inorganic phosphate, 84100 is not included in the CMP, so we need to add that. So that would be the complete description, and that's a need to know. Make sure you understand how I just explained that. If you don't understand, please let me know, but it's pretty straightforward. If you don't see it in the list, then you need to add it. But everything else needs to be performed in order to use the panel code. Let's move on to definitive drug testing or drug screenings. That's going to start from page 493. So right now I'm on page 493, and presumes is exactly that. So when you're going in for a job and they're trying to do a drug screening or a drug test, it tells you here that there's two different classes of drugs. I'm on page 493. There's the drugs that fall under drug class list A and the drugs that fall under drug class list B. Now, if a drug is mentioned and it does not fall under List A or List B, you are going to use CPT code 80304. And you can find that and back it up with the information provided on page 493 at the bottom, last paragraph, presumptive drug class screenings. So just make sure that you pay attention to that. Okay? And so for your drug screenings, there's two codes, 80300, and that's for drug class list A. You see that? 80300. So if your drugs fall under list A, that's the code you would use. And that's for any number of those drugs. But if it's just a single drug, you see that? Just a single drug, you're going to use CPT code 80301. And same thing for drug class B, you'd use 80302. And any number of drug classes is 80303. Okay, so just make sure you pay attention. They also have examples if you need clarification, located on page 494. They have examples. There's about 7 of them here. Now, let's say something comes back and it's positive as far as a drug testing. Then that's going to fall under your definitive drug testing. And then you would just list what drug was definitive, right? So if I use the example of antidepressants, 80338, because I didn't state the amount. If it was 1 or 2, I didn't, list the class. So if it's not specified, you're going to use CPT code 80338. Okay? So that's in reference to definitive drug testing and drug class screenings. There's a couple common modifiers that fall into the category of laboratory and path. There's 3 I want to focus on, and make sure you understand those 3. You maybe want to write those definitions somewhere in this section, but it's modifier 91, QW, and GA. Now, modifier 91, just so the insurance company knows, it's not a repeat testing. You may need to provide more than 1 test on a particular specimen. So it's intentional. So if it's intentional, you're going to append, right, modifier 91. Okay. QW is for a clear wave test. So these are tests that are usually performed in the provider's office. And remember, clear waved means that they do not need to have a clear number to actually perform these type of procedures. Okay. So the key thing that you're looking for in your question is that it's in a physician's office setting, and you'll see the acronym CLIA. Okay, and then you will know to append modifier QW. You're going to strike out the other 2. The other 2, they may try and maybe GA, which is the one listed here. GA is just a modifier added on to the CPT code that says, hey, we're getting ready to bill this to your insurance company. Just in case they don't pay, you are going to be responsible, because there's a lot of insurance companies that don't cover labs, right? Labs are sent off somewhere else, or they'll send you to go somewhere else for those tests. So GA would be appended to that. So GA is if the patient may be responsible. QW is if it's a clear wave test. And modifier 91 is if they need to perform more than 1 test on a particular specimen that is intentional. So they meant to do that. Also, make sure that you look up your codes for blood glucose and blood gas levels. Okay? Make sure that you look up the codes for blood glucose and blood gas levels. I want to spend a little bit more time on the surgical pathology. Remember, surgical pathology is going to start 88300. 88300. Okay. And remember that the 88300 is low. That means the specimen's not even placed under a microscope. It's not until, let's get there, 88300. Do you have that page? It's almost to the end, I believe. Yeah, so I'm on page 563. So that is going to start 88300 is your low level. And then once the specimens start going under the microscope to be evaluated, that's going to start from around CPT code 88302. A full description of the levels is located on page 563 under surgical pathology. And so it goes from low to extensive. So extensive is going to be around 88307, 88309. Now, those two codes want to mention there's also a procedure called the decalcification process. And the decalcification process is basically a procedure testing maybe the bone fragments or biopsies. And bone biopsies start from CPT code 88307 or 88309. So just pay attention to that in your question, depending on what they're asking. 88307, if I'm talking about the bone here, it's either going to be bone fragments or a bone biopsy. And with 88309, it's going to be a bone resection, which is the most extensive of the two. So biopsy 07, resection 09. If the decalcification process is involved, you will add that on. And then just make sure you remember the amount of times that the decalcification process is going to be performed. So you can put ×2 or ×3 just based on what is mentioned in your question. Postmortem examination is found on page 560. Turn back a few pages. 560. Okay, that's where we're going to start, starting from CPT code 88000. That's for autopsy, right, without the central nervous system. If the brain is involved, you can see there's a few codes to choose from right underneath it. One I want you to pay special attention to is your necropsy limited, which is CPT code 88036. Okay, that's a particular area, it's regional. Or if it's just a single organ like kidneys or the liver, you're going to use 88037. Last thing I want to wrap up with is your reproductive medicine, and that is found on page 569 in your CPT, page 569. And you notice that there's different types of reproductive medicine, right? You can see there's cryopreservation. We saw a little image of that in the presentation a little earlier. And that is CPT 89258 if it's for the embryo, or 89259, which is the sperm. Okay, so that's to freeze it. Then they have to store it, right? They got to store it. To store it, on page 570, you're going to use CPT code 89342 if it's an embryo, or 89343 if it is the sperm. Okay, that's to store it per year. So 6 months, 4 months, you're still going to use 89342. However, if it's about 2 years, then it's 89342 times 2. And then also, the last one here on this page, the section would be the thawing of either the embryo or the sperm. Thawing of the embryo, 89352. Thawing of the sperm, 89352. So in a nutshell, that's my little wrap up on what you need to know for lab and path. Please make sure that you pay attention to what I have listed on this slide. And if you have any other questions, please feel free to contact me at geneve@chroniclesbilling.com. Until next time, take care and enjoy the rest of your day.